And hospitals around the country are becoming overwhelmed, they're reporting, with COVID-19 patients. One of them in Utah maxed out its ICU capacity over the weekend. Here in Idaho, our hospitalizations have been steadily rising since the end of September. Our Gretchen Parsons has been working on this story today. She spoke with Dr. David Pate. He sits on the state's coronavirus task force to find out more about what is becoming a troubling trend. Gretchen?
Well, Mark, Dr. Pate tells me that as we see COVID cases go up, which we have, hospitalizations tend to lag behind about a week or two. He says we'll likely see our rate climb even more going into November. The latest data from the state of Idaho shows that as of October 14th, 221 people with COVID-19 are in Idaho hospitals. 55 of those patients are in the ICU. You can see on this graph from the state that since late September, hospitalizations have been rising. Dr. David Pate, who sits on the state's coronavirus task force, says hospitalizations will continue to trend upward.
Now cases are higher than they were even with the second spike. And of course, now that these are going up in another 1 to 3 weeks, we're going to see a big increase in hospitalizations again on top of what we've already got.
For now, Dr. Pate says Idaho hospitals are well prepared to treat COVID patients. But if they were to become overwhelmed, there are backup measures in place.
Hospitals can just decide to stop providing other non-emergent services, and so that can free up some capacity.
Dr. Pate adds that other spaces can be converted into ICU beds that wouldn't typically be used for patient care, but there's always a risk of a shortage of staff.
The important thing to keep in mind is that we are limited by staff. And so you can have all the beds you want, but if you don't have doctors and nurses and respiratory therapists and everybody to take care of them, then you still end up in trouble.
To prevent hospitals from becoming overcapacity, Dr. Pate says we can all do our part by keeping our distance, wearing a mask, and getting a flu shot.
We've already started having confirmed cases of influenza here in the Treasure Valley, and we know that as people get that, they'll be hospitalized.
Dr. Pate says another important reason to get your flu shot is because research shows that if someone is infected with both the flu and COVID, symptoms can be pretty severe. Mark?
Indeed. All right, Gretchen, we'll continue to monitor that situation. It's really, really remarkable how quickly those hospitalizations went up.